bringing together voices in child and youth healthcare. This is CAFC Presents.
CAFC would like to thank the following member organizations for their generous support of our knowledge translation activities: the IWK Health Centre, the Children's Health Foundation of London, McMaster Children's Hospital Foundation, the Children's Hospital of Eastern Ontario Research Institute, the Children's Hospital Foundation of Manitoba, the Montreal Children's Hospital Foundation, the Holland Bloorview Children's Rehabilitation Hospital Foundation, the Children's Hospital Foundation of Saskatchewan, and Trillium Health Partners. We would also like to thank the following Keystone and program partners for their ongoing contributions that support all of CAFC's programs and activities. If you have any questions or comments for our panelists, please type them into the question box at any time during the presentation. You can also share your thoughts and questions on Twitter by tagging @CAFCTweets and using the hashtag CAFCPresents. All of our webinars are recorded and can be found on the CAFC Knowledge Exchange Network. Use the CAN to share these recordings with your colleagues or register an account and post comments, links, or other resources that you think will be of interest. And be sure to sign up for the CAFC Presents weekly email newsletter to stay up to date with upcoming webinars and our recorded webinar archive. All right, hello everyone, and welcome to today's episode of CAFC Presents. I'm Doug Maynard, the Associate Director at CAFC, the Canadian Association of Pediatric Health Centers. And today we're going to be talking about lessons learned, the reach and impact of It Doesn't Have to Hurt, which is a science media partnership to reach and engage with parents about children's pain. Many of you in the audience, I'm sure, have heard about the It Doesn't Have to Hurt initiative over the last couple of years, possibly even on this very webinar series where Dr. Christine Chambers and Eric M. joined us about a year ago, I guess it is now, to talk about sort of what they were doing with this research project, what they were learning at the time, and now they're back to tell us sort of what they have learned and if they were successful. And if anyone's been paying attention to it, success is certainly not questioned. They were definitely successful, but they're going to tell us some of the other things that they learned along the way. So it's my pleasure to welcome back Dr. Christine Chambers, who is a clinical psychologist and professor in the Department of Pediatrics and Psychology and Neuroscience at Dalhousie University. She also has cross appointments in anesthesia, pain management, and perioperative medicine and psychiatry. And she's also the former Canada Research Chair in Pain and Child Health at Dalhousie University in Halifax, Nova Scotia. And hopefully joining her is her colleague in the It Doesn't Have to Hurt initiative, Erica M., who is the creator and publisher of the Yummy Mummy Club, Canada's largest independently owned online magazine. She's also the founder of YMCWorks.com, which specialized in integrated marketing programs for Canadian moms. Erica is having a little difficulty getting onto the webinar, so hopefully she will join us, possibly even partway through. And we are also pleased to welcome Isabel Jordan to the presentation this time. Isabel is one of the founding members and the current chair of the Rare Diseases Foundation. 15 years into parenting two children, one of them with a rare disease, has taught her many lessons, one of which is that partnering with healthcare providers and researchers can improve and inform both care and research. And she's going to join this panel and talk about the experiences and benefits of having family engagement in this type of a research project. So without any further ado, it's my pleasure to hand the virtual podium over to Dr. Christine Chambers.
Thanks, Doug, and hello, everyone. Thanks for joining us. We're really excited to be here, and as Doug just mentioned, Erica wanted me to pass along that, ironically, her son is in pain, and she's stuck waiting for the doctor. She's been at the hospital for 2.5 hours waiting, so she is really going to try to join us as soon as humanly possible for her. But again, very relevant to the topic that we're going to be talking today, that many parents struggle with, is how to manage pain in their children, and some of the work that we've been doing. So briefly, Doug already introduced me. I'm Christine. I'm a professor in Halifax. Also, hopefully joining us will be Erica M. And Isabel, who I see. Isabel, I typed your name wrong. That's not good. Isabel Jordan. Isabel, I was hoping you could say a few words about yourself.
Sure. First, I had to unmute myself, though. So I'm, as was said, I'm a parent, and I'm also a volunteer with the Rare Disease Foundation and with a few other initiatives. And I kind of snuck into this world because my son has a rare disease, and I ended up doing a bunch of advocacy because of our situation. And I found myself really wanting to improve care for him and for the other families and patients that intersect with the healthcare and research community.
And as a bit of background, I met both Erica and Isabel over Twitter. So before I'd ever met either of them in person, we had been interacting online. And so I think that's a kind of cool part of the story that we hope will come out, is how the use of social media and tools like social media platforms, including Twitter and Facebook, can bring people together and have worlds collide. So just wanted to give a little plug for the fact that we are doing some live tweeting during the webinar. Perhaps I've already had a couple of messages from clinicians who are in clinic and who can't get out, but perhaps you can join in by following the hashtag CAFCPresents, and I've also listed our Twitter handles there in case you would like to tweet along as you go as well. So to get started, I just wanted to get a sense of who is in the audience and who is joining us today. So for the audience poll, we're going to be asking who is joining us today. Are you a clinician, researcher, parent, trainee, or other?
So it looks like most of the people, 42%, are clinicians. 38% fall into that other category. 2% are parents, 9% are trainees, and 9% are researchers.
Okay, so mostly clinicians, and in the other category, we probably have some administrators and other types of people. So that's great. Thank you for joining us. The next question, before we jump into the presentation, is we're curious how many of you have heard of It Doesn't Have to Hurt. So your options are A, I have no idea what you're talking about. B, I'm learning about it just now. Maybe you just heard about it in the context of this webinar. C, I'm a little familiar. D, I've heard quite a bit about it. Or E, I've been an active follower. And
it looks like you do have some fans out there. Only 6% saying I have no idea what you're talking about.
Okay.
The most common answer being I've heard quite a bit about it. So, and 14% even saying they're active followers. So.
Oh, that's great. Well, thanks to those of you who've been following the work that we've been doing, and thanks to those of you too who maybe aren't quite as familiar but are joining in to learn a little bit more. So as a bit of background, I'm a clinical psychologist, I'm a health researcher, and for 20 years I've been studying children's pain, publishing, in journals, and hoping to make a difference. But we know from research and systematic reviews that have been done that there's this huge knowledge to action gap. Many of you clinicians would be aware of just how hard it is to keep up with the research literature. Even when there are clinical practice guidelines, they're not always implemented. And so I decided that I wanted to use social media as a way to reach and engage parents about children's pain management. My first attempt at this was creating a YouTube video. This would be about 3.5 years ago now. I hired a communications company, received a grant from the Nova Scotia Health Research Foundation, had a parent involved, and it was a very hard project for me. First of all, because we scientists are really good at creating boring videos that nobody watches, and we just don't know necessarily how to communicate and engage with parents the way that parents like to be communicated to and with today. So I worked with a communications company and we developed this 2-minute video, and 2 minutes is very short for any academic, but that's how long people typically view things on YouTube for. And we've had great success with this video to date, but it took a lot of time for me to kind of get it in front of people. And I learned a really important lesson through this project was, even if you can create compelling content for parents, if you build it, parents won't necessarily come. They won't necessarily come. And I think this is a real challenge to knowledge translation in health. We create wonderful websites or videos or tools that are really evidence-based, but parents don't have a way of finding out about it, and our circles of influence are relatively small. So I started tweeting, and this is one of the first tweets I sent about the video, targeted to Erica M. I'd been targeting all kinds of influencers, and much to my surprise, Erica wrote me back and said, she was flagging one of her physician bloggers who might be interested in writing about it. And the physician blogger wrote back and said, great video, great topic, I'd like to write about it. And so who is Erica? Some of you may remember her. If you grew up in the 1980s like me, from her days as a female video jockey on MuchMusic. And after having her own children, she transitioned her communications career into creating this incredible online website for mothers, and it integrates cutting-edge, digital media and social media. So I reached out to her because I had been following their site as a mom. I have 4 young kids myself, and I thought, how come, I don't have, we as researchers and health professionals, how come all of our great information, isn't embedded where parents are already going? And is there a way that we could partner? This is a blog that Kim Foster wrote about our video, and when it went live, we experienced a huge jump in the number of views to our video. And again, that gave me the idea, why am I, as a health researcher, trying to create compelling content for parents on my own? I'm not a video producer, I'm a scientist. And why don't I work with somebody who does this every day, who has expertise in marketing and messaging to parents, and also has an established reach. So currently through YMC, Erica and her team reach over 6 million Canadian mothers a month. So that's clearly far more parents than I could ever reach on my own. So I reached out to Erica again and asked if she would be willing to write a grant with me. So we wrote a proposal to the Canadian Institutes of Health Research with researchers, parents, funding organizations, and other stakeholders, including CAFC, and we were delighted when it was funded. So the project was funded to create, to develop, implement, and evaluate a 12-month social media campaign called It Doesn't Have to Hurt. And in this campaign, we wanted to tackle a range of topics in children's pain management, not just needle pain, which was initially my focus, but headaches and stomach aches, postoperative pain, recurrent pains like headaches and stomach aches, any kind of pain problem that children and parents could face, we wanted to tackle. We know we have all this great research evidence that parents were generally unaware of. So how it worked, we had a research team consisting of top scientists in pain from across Canada. We had our partner, YMC, who was in charge of creating content based on our research evidence. We had a parent panel, and Isabel will tell you a little bit more about that in a few moments, who helped us and guided us and advised us in so many ways. And then we had our partners who helped to amplify and extend the reach of our initiative. And because this has been the smallest, shortest grant of my career, we also engaged a lot of partners. Many of these are local companies in Halifax who I'd reached out to and asked for help. So Isabel, I'm going to turn it over to you for a few minutes. Did you want to comment a little bit about the parent panel piece, but also your perspective as someone who's very actively involved in patient engagement work?
Sure, I can do that. So when I came onto the project as one of the parent panelists, I was excited about it and interested. And but also when I come onto any engagement piece, I'm always a little hesitant because I'm never sure how it's going to go. I've done a few engagement projects, and some of them have been very positive, but to be honest, some of them haven't gone the way I had hoped. And what I really appreciated about this one is that as the project developed, it was quite clear that the parent contributions were being valued and respected and integrated within the project. And the way that they were done is, as you, I don't know whether you can flip back into the slide that showed the different, kind of the different pieces of the project. What was clear is that each of those different teams within the project were being really well used for their different expertise. So as parents, the information that we were providing, the value that we were providing, were for what was important to parents and the kinds of information that we were really lacking when it came to pediatric pain. So you were really coming to us for what was needed as families and what was important to us. So when you came to us asking what was important to us, you didn't then discount that and say, well, that's not really what we wanted to put out there. It really, when we said, no, this is something that's important to us, then you went back to the research team or to the communications team and said, well, then that's something that we need to focus on. That isn't something that's always happened with engagement opportunities that I've been a part of, where we, as patient or caregiver contributors, we might have said this is important to us, and then it kind of went off into the nether, and it was never really integrated. It always kind of, with It Doesn't Have to Hurt, it was integrated back into the project and then kind of fed back to us it was kind of really a back and forth conversation. And that isn't something that always happens with engagement opportunities. And there were even times that I remember that there were contributions that we made that perhaps weren't. I remember there was one in particular. There was some language in one of the Yummy Mummy videos that the research team wasn't quite sure of. It was a little risque, and the research team was a little bit taken aback on it. But the parents were quite. I think all of us were like, no, that's pretty much how we talk to each other, and that's what's going to resonate with us. And you went with more what the parents were saying because you were, ultimately you were reaching out to parents. So we really felt that our contributions, or I felt, I can't speak for other people, that our contributions were valued. And I think what's important about that, there's projects that I've been a part of that I've then stepped away from because, as a caregiver, I'm at home with my kids, and especially with my son who has a lot of medical needs. I'm homeschooling him, I'm taking him to a lot of appointments, and I'm picking and choosing the things that I'm going to be a part of. And if, like any job, if my contributions aren't going to be used, then I'm going to stop doing it, and I will take my time elsewhere. But with it doesn't have to hurt, I will keep contributing as long as you need me, because there's a point to it, and they're going to be used.
Yeah, and it's funny, Isabel, you're referencing, there were a couple of times where it was interesting where we had sort of a lack of congruency between how the research team felt about one of the pieces of content, and I'll show you everyone on the webinar some of this in a minute, and what the parent panel felt. And I'm one of those was where we had a blog post where the blogger had written about menstrual pain, which was a topic parents had wanted to hear about, and included profanity. And when I sent it to the research team, they were up in arms. Christine, this is not professional. But when I sent it to the parent panel, it was really interesting because every single member of the parent panel was like, love it, real, emotive, caught my attention. And sure enough, when we did an analysis of like average view duration of all of our blog posts and content, that particular blog post had the longest view duration of any blog post we'd had all year. And it's been challenging for me as a researcher at times to know how to navigate and balance the different input I'm getting. Do I listen to my scientists? Do I listen to the parents? And I've had to really think about, well, what do I have the scientists there to represent? What is their expertise? And then what do I have the parents there to comment on? And of course, Erica and her guidance as well, knowing the parent sort of audience. And so as a researcher, it means giving up a little bit of control and being brave when going back to your colleagues and saying, look, I know you all feel this way, but I'm getting this feedback from the parent panel. And I will say, as a scientist, I found it very helpful, and I didn't plan it this way, but I ended up having the same number of parents on our parent panel as I had the number of scientists on our research team. So I do think it helped when I went to the scientist and said, look, I'm going to make this decision because of the parent input, that it wasn't just one parent or two parents. It was a whole panel who collectively had as much strength years. And having a panel of parents made it easier for different people to step up at different times, appreciating that people want to be involved, but if their child's in crisis or has a medical issue, that it may not be a good time for them, and creating a situation where I hope that parents didn't feel pressured or that the whole project was lying on them.
Can I interject?
Yeah, what are your thoughts on that?
So a lot of projects that I've been on will have, or committees will have one parent or patient voice, and that is a really difficult position to put somebody in for those two reasons. One, I'm in a few where I'm the one patient voice, and it makes me feel that, that doesn't make me feel, it puts me in a position where when I can't be there because of, sometimes it's a healthcare thing for my son, but sometimes it's just normal life that all of us have, that when I'm not there and I can't make a meeting, it means that the patient perspective won't be recognized and won't be there. So it's a lot of pressure on one person to represent a whole community, and also the pressure that I am one single person with one single perspective having to represent an entire community that I clearly can't represent because I'm only one person. And it also makes it really hard for a single person to speak up, because there is a power dynamic there of people that are entrenched in the system, and then patients are, slowly coming into a system. And it does, I'm getting more used to it because I do it a lot, but it makes it very difficult for people to speak up when they are going to be the one divergent opinion, because we are coming from a different perspective. And having that whole panel, knowing that you're in a group of people, does make it a lot easier to speak up. It totally changes things, and I appreciated that structure a lot. And I also recognize that it's harder for you to do as a researcher, to have that equality of voice. If I could put a plug, like with Rare Disease Foundation, we do that with our research grants, where we have our science reviewers and our lay or our rare disease community reviewers, and it was for the same reason. So we have that equality of voice coming from both perspectives and kind of equalizing both and giving equal value to both. And I think there's a huge value in that.
And I do think, I'll show some slides in a few minutes about what our content looked like and what our reach has been, but I do think that part of the reason why this has been successful is that we were able to create a synergy among different groups of people who all had an interest in a topic, whether they were organizations like CAFC or the Canadian Pain Coalition, or funders like CIHR, the Nova Scotia Health Research Foundation, the scientists, YMC, the parent panel. Everybody had an interest in helping reach the same goal, and we were able to leverage all of our strengths. I wasn't trying to pretend to be someone I wasn't as a scientist. I was bringing forward the best science. YMC was bringing forward their best communicators and storytellers. The parent panel was bringing through their authentic experiences and their authentic opinions. And I also think, we had on the parent panel, we had a mix of moms, dads, grandparents, and because it all happened virtually and this project was virtual, they were able to be from rural areas. Like we have a mom on the parent panel from Tatamagouche, Nova Scotia, Isabels in Squamish, BC. You didn't have to attend a meeting at a hospital. You were able to sort of flex it and respond when it was hopefully convenient. So those are some of the things that I think worked well. So in terms of what the content looks like, these are our blog posts, which are sort of the foundation of the campaign, where we had bloggers, sometimes parents, sometimes health professionals share research evidence. And really, this was as simple as the research team, the parents would help us identify the topics that we should cover. And then the research team, we would prepare literally one-page evidence summaries. What do we know about vaccination pain? What do we know about, post-surgery pain? And then YMC would take these and literally knowledge translate them. Literally translate them into, well, we think this would make a good blog post. We think this would make a great image. We think this would make for a good video. And they would engage their storytellers in telling stories that are powerful narratives, which are very compelling to people, but that would sort of seamlessly embed evidence. This is one of our Facebook polls, and we had a number of these throughout the year where we actually asked parents to engage with our content and incentivize them. So these are strategies that are known to promote engagement in the sort of online parent community. And, go watch our video and then come back to us. And, you can see one comment here from a mom. I had not heard of these strategies before, but all three would be easy to incorporate into medical procedures for babies. I'll be passing this information on to other mothers and women I know. And that was really the goal with It Doesn't Have to Hurt, was to create, free, publicly available information that we could share with parents and get parents to engage with us on, but also to give parents evidence-based information they could easily share with other people. These are some of our videos, and the one in the top corner won a prize from CIHR featuring Jack Horgan talking about ways to relieve infant pain. And yes, we had a video, how a bikini wax inspired a mom to help her daughter's pain, and this was Erica's suggestion. And it was edgy. It was not something initially the research team felt all that comfortable with, or at least all of them did. But of course the parent panel just jumped on board with this, and they're like, we love it, totally funny, interesting. And I've learned a lot about it from Erica this year around, what kinds of content grab people's attention and are more likely to kind of be clicked on. We also were featured in YMC newsletters, and my issue is that, yes, these days there's a lot of information that parents can find themselves, but I think we really need to be bringing health information to parents, and bringing it and putting it where they're already going. So again, maybe you don't even know that there's solution for your kid's stomach aches, but you're looking for a creative toy storage solution for your home, and you happen to see that there's something here on pain. Maybe you're looking for creative lunch ideas or Halloween costume ideas, and then you happen to see some sort of content about flu shots and pain management, and you realize, oh yeah, I'm taking my kid for a flu shot next week. So we can't always expect parents to be actively looking. I think we need to kind of help position it in front of them. And in fact, when we did our survey of parents and asked them, what do you think of this partnership, and what else would you like to know? Parents were like, we love this, and there's so many things we want to know about. We just want the scientists to tell us, what great information you have that you think is relevant. We also had these Twitter parties, 2 of them so far to date, and for those of you who aren't familiar with Twitter, it's also called a Twitter chat. You get online at a designated time for an hour. You collect around a particular hashtag, and you can have an online conversation. And so these 2 Twitter parties have been very successful. In the first one last March, we actually crashed the About Kids Health website, directing so many parents to some linked resources. But what it allowed us to do was actively engage with parents, give them an opportunity to have the scientists who've actually done the research answer their questions. And also, the scientists have really been learning from the parents. So, we kept getting asked questions on topics that we didn't necessarily have any evidence for, like teething pain, menstrual pain was one of those, growing pains. And in the beginning of the project, I just kind of tried to ignore it. But then, Erica was like, Christine, the parents are asking, you need to engage with them on these topics. And some of them we were able to synthesize the very basic information we have, but on others we simply had to say, we don't have any research recommendations for you. You tell us what you're doing and we'll study it. So this project has really allowed me to get a sense of what parent priorities are within children's pain and how the existing scientific literature may or may not line up with those. And I don't know, Isabel, do you want to comment at all on your involvement in Twitter parties and Twitter chats, and any thoughts on that?
Well, for me, those Twitter parties, the tweet chats that you had were some of the most active ones that I'd been on, and the range of people's questions was quite amazing, but also echoed a lot of the questions that I'd had about kids' pain. I mean, I had been quite focused on, for me, quite specifically on my son and his issues because he's got medical problems, but it made me realize how many questions I really had kind of about everyday pain issues that my daughter, who doesn't have any major health issues, but kind of the everyday stuff, the growing pain stuff, the menstrual pain stuff, that I thought, I don't really know how I'm going to handle those things with her, and I better kind of get on the ball with that as well.
Yeah, and I think your point around the sort of level of engagement and how active they were, I mean, if I had tried to do this on my own and been like, hey, I'm going to host a Twitter party, come on by, I don't think anyone would have shown up. And that's all about working with an expert, and Erica, who knows how to host a good party and knows how to engage parents in a way and has a structure to make that happen. And so I think, again, this is a mistake that we health researchers sometimes make, is we hear about a concept in technology and we think, well, let's jump on that, and then we just can't make it work ourselves because we don't have the expertise in digital marketing and media to know really how to make it fly in a way that's going to work for parents.
I read a paper recently about, I can't remember which group it was, but it was around using social media to, I think they were using Twitter and Facebook to get information out about a specific clinic, and how the results of the paper was, well, it didn't really work, but they were doing it within their clinic and not engaging outside of that. And it made me think of just that you can't just do it on your own. You need to engage experts and look outside of yourself to really make it work.
Yeah, absolutely. I've seen some of those papers and posters as well, and they say, oh, it didn't really work. And I'm like, yeah, but maybe you didn't do it right. Like, there are people who actually have expertise in this that we can work with. Yeah. We were also really excited when we had an opportunity. Twitter Canada reached out and saw what we were doing online and asked if we could come to their headquarters to host our next Twitter party, which was in September. So we did our online Twitter party at Twitter Canada headquarters, and we were really excited to receive some special funding from CIHR to be able to bring together all of the stakeholders who've been involved in this project. All of the members of our parent panel, including Isabel, all the scientists, all the digital influencers, the bloggers, the content creators, Erica and her team, the funders, organizations. We all got together and were able to meet in person at the conclusion of what was a really special project where we'd all gotten to know each other online. We've had a lot of, again, social media buzz, a lot of information sharing, which is wonderful, parents sharing their experiences, and we have so much data from this project that we are using to try to inform next steps and evaluation. And to give you an idea of our reach, I'm going to turn it over to Anne at CAFC to show a brief video about our reach and some of our success parameters so far.
It Doesn't Have to Hurt is an innovative year-long partnership between YMC and the Centre for Pediatric Pain Research. It was funded by a Canadian Institutes of Health research grant. YMC and CPP are breaking new ground in knowledge translation. The objective? To help educate parents on managing children's pain and to disseminate important findings about children's pain directly to Canadian moms and dads quicker and more creatively. We did this by weaving compelling personal stories with evidence-based research. We leveraged the award-winning YMC and M&Co's influence in the online mom community with the medical community. There was both a national and grassroots omni-channel approach, amplified by a passionate team of mom influencers. Word of mouth amongst moms changed behavior. Posts on the YMC website had over 42,000 page views. Our videos were popular with moms, 150,000 plus plays on YouTube and Facebook. Our It Doesn't Have to Hurt Twitter party trended nationwide and drove so much traffic, we crashed the Sick Kids website. Our polls reached over 916,000 on Facebook alone. Our social media generated over 3 million impressions in earned media. Information about pain has reached millions of parents, empowering them to advocate for their children's health. Scores of national, international, and local press coverage for It Doesn't Have to Hurt. This partnership has earned highest accolades from the health and pain research community. The results? Meaningful dialogue between parents and pain researchers, generating over 100 million impressions to date for this grassroots campaign.
So as you might imagine, it's taking us, we've got so much data, and this, I joke with people, is like the worst research design of my career, but potentially the most impactful project. It's not easy to study this in a rigorous way that scientists typically like to study. This is not a randomized controlled trial. There is no control group. And so it becomes very challenging to know how to operationalize what is success. Also, because it's very virtual, it makes it really difficult for me to, I can't parachute into people's lives and go along with their children and, make sure that they're getting good quality pain management as a result of this. So that has really been part of our challenge. How we've approached demonstrating success is combining our reach data. So we have extensive analytics from YMC about every piece of content, what was shared, what was liked, how long it was viewed, how many people saw it, and so all of that data is wonderful. We've also done parent online surveys and phone interviews with parents around their awareness and use of pain evidence. And just to give you an idea, in 2 weeks, YMC was able to recruit over 1,800 parents to take part in a survey for us, which is like the most participants I've ever had for a study in a 2-week period in my career. So not only is this a highly efficient partnership in terms of actually, knowledge translating with parents, it's also a great way to collect data. Of those 1,800, over 500 of them expressed interest in a phone interview. I was hoping for 30. So needless to say, we had a lot of phone interviews to get done in a short period of time, and we were able to interview just over 200 parents. And in terms of our preliminary analysis of how aware of evidence parents are and how much they're using it, for those of you stats junkies, we have had a large effect size for awareness of evidence and a small to moderate effect size for adoption of evidence. And what we think is going on here is that parents learned a lot and just didn't have necessarily the opportunity to use it in the window that we evaluated. So, maybe you learned about what to do if your kid has day surgery, but your kid might not have needed day surgery in the period that we assessed. So we're planning to go back and re-interview all these parents in the fall to sort of touch base with them around, what else has happened in the course of the year. So this is just again a plug for the live tweeting that we're doing. There's been some great tweets coming in and some wonderful comments. And then we wanted to open it up for a bit of a discussion and between Isabel and I, and hopefully Erica if she's able to join us, but also taking questions and comments as well. I don't know, Isabel, I've done a lot of the talking so far. Are there any points that kind of popped into your head as we were going that you wanted to elaborate on?
One of the things that I keep thinking of that expression just when it comes to taking in everybody's expertise that wasn't on the project. I keep thinking of the expression of people staying in their lane, where you really, one of the things that I appreciated about this project is you respecting everybody's expertise in their areas, about the research panel, the Yummy Mummy Club experts in communication, the parents and your partners, that you did a real balancing act of taking in everybody's expertise, which had to be a little tricky in having everybody be okay with that, because there's a lot of people that are used to, maybe not so much the parents, because a lot of us are used to being ignored, but when it comes to the researchers and to the experts in communication, they're kind of used to doing things their way. And you kind of balancing that, saying, no, we're going to have to this time listen to these other people as well. And there was a lot of learning opportunities for balancing out those different voices as well. And I really think that's the way to move forward in a lot of different projects. So I thought that was really interesting about this project.
Yeah, and that is an interesting point, because I think increasingly in health research in my world, there's more and more that we're expected to do that we have no training in, in knowledge translation, patient engagement, and these are things that are so important. But, it's impossible, I think, for scientists and health professionals to try to do this effectively on their own. I like that saying, staying in their lane. It's true, and I don't think we always work in an environment that encourages us to stay in our lane. And cross boundaries with people who are also staying in their lane. And I think that's what's been, one of the most enjoyable parts of this project for me, is working with people from different areas and with different expertise who are at the top of their game, who, the parents we have on this parent panel who vary in terms of their level of, experience in prior research. I mean, some of them have been quite actively engaged, like Isabel. Others, this is the first time they've ever been involved in something like this. But they have voices that they're happy to have an opportunity to have heard. We have these communications, experts who, they turn this content that we provide, the science, into beautiful images and videos, and I just can't even describe how amazing it is to kind of open these documents and see how fantastic the content is. And then working with scientists who really know the science inside out, so we can get the messaging correct. And then, of course, organizations like CAFC, Nova Scotia Health Research Foundation, and the Canadian Pain Coalition, who are really, really at the forefront of trying to innovate and help ensure that evidence gets to families and to parents. So yeah, I think there is that sort of synergy that comes about. I also think for me, this project, the lesson learned is it's good to take chances and trust other people. We researchers tend to be control freaks sometimes, and some of the best things that happened this year that I think were meaningful were when I gave up control, when I was willing to take chances. And I don't necessarily, know that we're very good at doing that.
I don't think any of us are really that good at doing that.
I don't know, Doug, should we see if there's any questions or comments? I have a whole list of lessons learned that I could go through, but I don't know if there are any other sort of audience comments.
Yeah, we'll just give the audience a chance to type those questions into the question box that's in your control panel as you think of them. Don't feel you need to wait until we ask for questions or get finished a question. Just type them in as you think of them, and we'll get through the list as we go along. The first question that came in was from Sue, and she says, "I love that you created a team of families, scientists, and communication creatives. What were some of the barriers voiced by researchers to engaging families, and how did you overcome them?"
Yeah, I think, the researchers that we had on our team were all very enthusiastic about engaging families. I think the biggest barrier is just, how do you do it? And for me, I was able to reach out and get a consultation from our patient engagement coordinator, who's attached to our maritime SPORE, that's a strategy for patient-oriented research support unit, and I asked for advice. So I sat down and met with him and explained my vision, what I would need to do, and he sort of actually got the ball rolling with the initial sort of consultations, and then I was able to kind of carry it from there. So I think probably one of the biggest barriers is knowing how to do it, and knowing how to do it in a respectful way. I did decide that I wanted to be the point of contact with the patient panel, because I wanted to really kind of be in the weeds and really develop a relationship with each of the panel members. So but that it does take time, and it was fascinating, though, for me at times to have these two email threads going, one with the scientists and one with the parents, on the same piece of content, and getting different feedback. But a lot of the times the feedback lined up very nicely too. So in this project, I think because it was virtual, I would have loved to have had a larger budget. We had a funding cap on this budget because of the grant that I'd applied for. So it certainly wasn't the Cadillac version of what I would have liked to have done and how I would have liked to have compensated people. But I think it certainly showed that with a relatively small budget, you can create something kind of synergistic, again, by playing off of people's strengths. I don't know, Isabel, your thoughts on barriers that people have experienced around engaging patients?
I've seen a lot of different kinds of barriers. A lot of them having to do with having enough patients in the room to really make a difference. A lot of barriers around accessibility that people don't think of, probably because they've never actually talked to patients before about what they need. One that's been a lot on my radar lately is people will have engagement opportunities, and because the meeting times and places that are convenient to researchers or to healthcare providers will be in their offices, which will be in hospitals, they will just automatically pick a meeting room that will be in a hospital, not realizing that there's a lot of patients and caregivers for whom hospitals are quite traumatic places to be in. So even accessibility of place will be a big barrier. So they might initially automatically be discounting a whole group of people that won't even answer an engagement opportunity. So there's lots of little things like that that aren't thought of initially. So sometimes even before creating an engagement opportunity, it might be important to speak to patients about how to create that engagement opportunity, if that makes sense. A pre-engagement engagement opportunity.
Yeah, and I have to say that, I routinely, will reach out to Isabel, and ask for her advice on something, whether I'm on a, even unrelated to this project, I'm organizing a conference and I want to engage patients, and how should I approach this? And, I think people often talk about patient engagement and there's no patient in the room. And so reaching out to the patients to ask them, how might this work? What would be best? What do you think the patients, or parents might prefer, instead of kind of mind reading what you think could work and then not giving them an opportunity to join in that discussion. And for me, I'm often nervous about intruding on people's time. And I actually got way more comfortable as the project went on, communicating with the panel, because initially I was like, I don't want to bother them. They have jobs, or they're taking care of their children full time. But every time I did, the product was better, and so I just kept kind of going back to them and feeling like I needed to get over my own concerns around intruding or asking too much. So sometimes the barriers that researchers have might be from within.
I think the best attitude to have going in is to one of respectful dialogue from the beginning. So if you want to find out what the barriers are to a certain patient population, is to find out who it is that you need to get information from in order to make your project better, who it is that you want to engage, and find that group of people and ask them, what are your barriers to participating? And, as long as you enter into that respectful dialogue from the beginning, they're the people that know best what their barriers are, and then work together to try to overcome them. And if you enter that dialogue respectfully from the beginning, you're going to end up with the best solution.
Yeah, I agree.
One of the things is, and it's a shame that Eric hasn't been able to join us yet, because she has such a unique perspective. I mean, most of the people on the call are coming from that healthcare perspective, either as clinicians or as families that have had some significant experience in the healthcare system. But one of the things that's always struck me is just in participating and having the conversations with her, where I've heard her talk about the project, is, Christine, you've always sort of presented this as the value that YMC brought in helping disseminate this content and getting an audience. But it's always interesting to hear Erica and her team talk about how valuable this project was to them, from people who are the content creators and having access to evidence-based, credible information, because that's something that they always struggle with. They're always trying to write this kind of information on their blog that's relevant to parents, but they're always struggling with what are the best sources to find that information. So I think it's always been interesting to hear her perspective, and actually Anne just pointed out that I think maybe she has been able to join us, so maybe she can comment on that. But I've just always found that interesting, in that we always see them as this valuable tool for us to disseminate information, but it's always interesting to hear them talk about how valuable it is to them. And my question for you, while I'm not sure if Erica can actually hear us yet, but
I'm here.
Oh, you're here.
Hi.
You have perfect timing.
I'm in the son's parking lot of his school doing this. I apologize to everyone that I'm behind, but he was in pain, and I had to deal with it.
Well, we know what that's like, and this is a perfectly appropriate crowd to appreciate that. So Doug was just making a point that was just perfectly relevant for you to come in. We've been talking a lot about the value from our perspective, those of us interested in health, in our partnership, in getting the word out. But his point was around how he's heard you comment before about what the value added was for you guys to work with us, and your thoughts on that.
Well, there were two conversations. I can speak about the value add as a publisher and a marketing agency. The value add for us is that there was fantastic content where we were able to create compelling storytelling and great information for our audience. So it was a win for us because we became a great resource for families. And obviously all the information is evidence-based, so we know that they're getting credible information. So that was fantastic. If you want to take it to another level, for me as a parent, being involved in this project as the creative director, but also as an ambassador of the program, and learning so much about now children's pain, is that my daughter, for example, yesterday had to get an oral test for anaphylaxis. And while she was there, someone came in and asked if she would be interested in participating in research. First of all, I was like, whoa, I now understand a little bit about research because of This Doesn't Have to Hurt program and how there's a lot of talk about research, so I'm getting educated about that. But secondarily, they said, all we need is some blood. And my daughter looked at me, and we both knew that she could get this blood taken because she knows now that it doesn't have to hurt. And so there is a secondary byproduct by educating parents on a variety of topics. In this case, it was on mitigating pain for needles. So now we're enrolled in other research to help other families. So there's all these sort of secondary benefits by educating really regular people, end users, about various diseases or how to cope with problems, because sometimes you don't actually hit the person you want to hit, but the person that you hit can tell someone who is the right person. So I think that it's really an amazing opportunity to share useful information that every person can appreciate, understand, and then share it in their circles through word of mouth.
Yeah, I think that storytelling piece and that a bit capacity to share. I mean, parents are giving each other advice on social media all the time. I mean, there's tons of data to support this, and by creating this incredible content that's all evidence-based, but is very relatable for parents and doesn't look like the typical boring hospital brochure, I think just makes that so much easier. And I think that's the spread that we were really hoping for, that we believe we were able to achieve.
I think also interesting, Christine, that when we were at the hospital a few minutes ago, they handed my son a pamphlet about not falling, just in case, if you're feeling unbalanced. And he laughed at it because the way it was written is just so not relevant to who he is. And to me, when there is a partnership where you are creating knowledge translation in a modern, unique way that resonates with the end user, my suggestion is to think about how to take that information and share it in unusual ways. So, for example, If It Doesn't Have to Hurt actually has partnerships in hospitals where they can give parents iPads with this content on it while they're waiting, for example. If they're waiting to get vaccines, parents can watch these videos. So the idea is, don't just create this fantastic content, but you have to go where the parents are and come up with, or the end user in whatever scenario, and come up with new ways of getting that information in front of the right people. So it's not just creating content, but it's also where do you want to put it. So, for example, I know that there's a lot of screens now in hospitals. Why is that content not on those screens? So you just have to think in new ways.
Isabel, I'm curious what your thoughts are. I've heard you comment on some of these themes in the past as well.
Yeah, no, that makes a lot of sense to me. We've seen or ignored so much patient information brochures that are not relevant or not put in a way that makes any sense to us, or just not written in a way that is relevant to us. And there's so many resources out there that could be done better or done with patients instead of, there's a lot of times where they're done without patients and then given to a patient to comment on afterwards, which is just way too late. There's a lot more opportunity to be done in an innovative way. There's so much waiting time at hospitals, as you know, Erica, that could be used better. Hours and hours and hours of time that we could be using in a better way.
And I think what's interesting also is that from having sort of lived in this world of research for just a short period of time, I understand that those who are involved in creating the research are very married to every little bit of information that you've created, and that there is definitely a challenge to understand what are the key points and how do you tell them succinctly and efficiently and in language that will interest the end user. And I think that is one of the, I think that's the secret to the success of the It Doesn't Have to Hurt program, because the scientists let the storytellers create the content. And sometimes I know that it was painful for Dr. Chambers and her team to let go of a lot of the what they felt were some of the key findings in that research, and let us choose what we thought as the end user would be most compelling to the end user, because really you cannot get all the information that you've worked so hard on to be interesting to people like me. So I think that it's key to understand that you have to be able to summarize things, but also use language that you may be uncomfortable with in the fact that you're, in a way, dumbing down the information or making it sort of infotainment-like, and that shouldn't be a negative. That, in fact, should be of understanding that you're creating this product, so call it your brochures or whatever it is, not for you, but for families, for people who really don't understand science, and often their eyes will glaze over. So you have to think, what would they like? How can I connect with them in a way that it will actually make sense, and they'll remember it. It will become meaningful to them. That's the key. So it's not about the science. It's about the strategy of telling the science in a very simplified, entertaining way.
Yeah, I agree. So I see we have 5 minutes left. Doug, I don't know if there's another question that we could quickly field.
Yeah, I think we'll take one more question here. This one came in from Lori. She says, we struggle a bit with how we keep families authentic voice involved in the knowledge translation or in telling stories, or involved in a research project. But at the same time, to have those family members be educated enough about research to not have unrealistic expectations regarding research. I mean, a lot of us, or a lot of sort of people outside of the healthcare system, you watch TV, you see someone diagnosed and cured within an hour TV show. So we do develop sometimes these unrealistic expectations around healthcare, around research, etc. Have you learned anything about how to engage families while managing those expectations of what the research is in fact going to tell them at the end, or anything like that? Was that an issue at all, and if so, any ways to manage that?
Yeah, I mean, I have a couple thoughts on that, but I don't know, Isabel, did you want to say anything to that point? Because I know that's something that gets raised a lot in the field of patient engagement.
Again, I think it's a lot about clear communication, and it's not something that always happens in these engagement opportunities. Like I said, it's done better by some people than by other people, and there just needs to be a lot of clarity from the beginning about roles and what's going to happen. I've been involved in opportunities where my opinion or my contribution has happened without context, and I think that's where confusion happens. I think the context of everybody's role needs to be quite clear, and the context of the project. So the best projects that I've been on have been very clear about, where I've been, say, a patient partner. I've been told that, we're putting in a grant, this is the timeline for when we'll hear back. If we hear back, this is a 4-year, if it gets funded, it's a 4-year project, and this is your role. We're not going to hear back until then whether or not it gets funded. Just a very clear timeline about what happens and what the potential for the project is, and it doesn't take a long time to create a timeline for somebody and create clarity, and then you're educating as well as creating expectations. But a lot of people just skip that step in the assumption that the person knows. So as long as you don't have assumptions going in, then you can create that space for knowledge. And I think people are fine with that. And I don't think it takes that long to do it. And then everybody's roles are clear. It's all about that respectful clarity. If you were going into, and maybe because people in science aren't in business, and my background is more in business, where we have timelines for projects, and when we go into a business partnership, you have to create these. And you always do this. it doesn't happen as much. If you treat it as a business partnership, if you treat patient partners as business partners, you would always do this. That you would always create clear parameters for that partnership, and then I think that would cut that down quite a bit.
Yeah, I mean, I just want to echo Isabel's point around clear communication, around expectations, not making assumptions. And also, Isabel, I'm going to use this quote all the time, staying in your lane, right? Like, I'm not expecting the parents on our parent panel to give me advice on statistics, right? I am looking for their input on particular issues where they have the authentic voice. And likewise, Erica and her team, I'm not expecting them to advise me on the statistics. That's my job as a scientist. What we were able to do here is leverage their incredible talent and communication and their reach and so on. So I think, these partnerships between patients with stakeholders and real talent and companies that know how to do this and do it every day for a living and extending that over to the health sphere makes a lot of sense. So I'm aware of the time. We did have one last quick poll for those of you who are still with us. Thank you all for joining us. We'll end with, could this kind of partnership help to engage parents with other health evidence? This is something we're really interested in. We've done this for children's pain. Do you think there's merit in doing this for other health areas? So either nah, I don't think so, B, I'm not sure, C, maybe, D, I think you're onto something, or E, absolutely, let's do it. And I can say that we're very keen to talk to other people who have health information that they want to share and engage with parents on, and be happy to connect with you and talk about ways that are what we think, science, media, parent partnership, how this could be useful in mobilizing research evidence in other ways.
All right, well, while we're just letting the answers come in here, Christine, I had one more question for you. So just going through this process, engaging a media partner like the Yummy Mummy Club in the research, on the research team, creating the content, et cetera, has that, and the Yummy Mummy Club being, the perfect media partner to target that audience of parents, largely mothers, that would be interested in this topic, have you thought of any other sort of non-traditional media partners that people aren't thinking of? Like if you're speaking to other researchers in the audience, when you're saying, is it your recommendation that they should be seeking out a media partner for some projects, and who might that be outside of mommy bloggers, outside of journalists? So have you had any sort of light bulbs come on about other sort of media a knowledge translation vehicle kind of partners that you've thought of just in this process?
Right. Well, I think, it's important to get inside the head of the people that you want to reach. And I think, depending on what your goals are, what patient population you're wanting to reach, what organization you want to reach, it's, ask them, where are you already going? When you're going online and searching for information, where are you already going? And, for me, I sort of had the opportunity as a parent to know where I was already going, and to know what, media outlets and what website I was going to. And then not to be afraid to reach out and ask. And so certainly in this case, I reached out to Erica at YMC. I also reached out to a couple of other parenting media, and I met with them all. But I could tell from our very first meeting that, YMC was the right match for me in terms of, the way that their company was structured, the sort of creativity and leadership that Erica showed. And also when I met with her, I just knew that she got what I was trying to do, and was able to show some flexibility. But I think, ask and think outside the box. Don't think about the typical places. Really think outside the box on that.
It looks like everybody, or most of the people, think you're definitely onto something, and at least you're onto something, or you should absolutely do it. Use this model for other health types of health evidence.
Okay, few. Isabel, Eric, any last words?
No, I think you said it all.
I certainly am really open to having Christine work with us, work with my agency. We actually, I don't know if anybody understands this, but YMC, Yummy Mummy Club, is a website which is owned by the company M&Co, which is our marketing agency. And so this is not really simply a media relationship. This was done through an agency. And so if there are other people who are interested in working with an agency to better understand how to connect with parents, that is what we do, is we create branded content with companies like soap companies and, travel companies, etc. But we also understand the subtleties of knowledge translation, and it really would be great to be able to work with other companies, other researchers who have a target market of parents.
Isabel?
Yeah, I just want to underline the fact that if you want to understand how to work with families and how to work with patients, the best thing to do is to engage them early, and it gives direction to your research, because patients know what they need, and the only way to understand patient perspective isn't to imagine what they need or imagine what goals they have, but to talk to them. You can't speak for patients, you can only speak with patients.
And Isabel, it's interesting that you say that, because that was, as you know, a key component of this It Doesn't Have to Hurt program, which, because I sadly wasn't here at the beginning, but we didn't just create content in partnership with you and Dr. Chambers and the team. What we created were opportunities for engagement, which is significantly different. And I think that is a really key piece of the equation, where if you are planning on doing this this kind of a program, don't just think, oh, we can create some blogs and we can create some videos, etc. That's just the beginning. What you really need to be talking about, first of all, is how can we engage parents? One of the tactics would be to have blogs or videos, etc. But there are so many other ways to engage parents, so you can learn from them and hear what they're saying and have that patient engagement, rather than just pushing out what you want people to know, because that's just a one-way conversation, and that's not social media.
Exactly.
Yeah. Well, I know the three of us could talk about this forever, but we should let people get back to their lives. Thank you both for joining in. Eric, I'm glad you could make it. Isabel, thank you for being here. And thanks to Doug and everyone at CAFC for giving us an opportunity to give this update on our work.
Thank you all.
Well, thank you. Yeah, thank you, Dr. Chambers, Erica, Isabel. Fantastic presentation, and thank you for trying to wrap this up on time, Christine. But I'm sure with this great conversation, people didn't mind going a few minutes over. But no, it's really been great. It's been our pleasure at CAFC to be a part of this work and to support it and help with the dissemination, and of course to participate in the Twitter parties and stuff. Has always been a lot of fun. So thanks for inviting us to be a part of this.
Thank you. Well, working together, we can all do more. So it's been great.
All right, and with that, I think we'll wrap up. We do, as most people know, our webinars every Wednesday at 11 a.m. Eastern Time, and it's always great when you can watch live, as you can ask your questions and participate in the comments and the discussion, or either on the webinar or on Twitter. But when you can't watch live, we do record these sessions and make them available after the fact on the Knowledge Exchange Network, which you can find at www.ken.cafc.org. That's ken.cafc.org. Next week on May 24th, we'll be welcoming Dr. Sarah Kirk to talk about shining a light on weight, bias, and stigma. Is a focus on the scales helpful or harmful to the health of our children? And in this webinar, Dr. Kirk will discuss the challenges of the prevailing focus on weight as an endpoint rather than on health disruptive environments that impact everyone. She will also share evidence-informed strategies and solutions for future research, policy, and practice to reduce weight bias and stigma and support health for all Canadians regardless of weight. And then following that, we'll be hearing about the Trek Peds Pack, having what you need at the bedside to manage acutely ill children in the emergency department. Peds Packs are evidence-based point-of-care resources for managing critically ill or injured children, and these tools are intended to be used at the bedside in community and tertiary pediatric emergency departments across Canada. The available resources consist of both cognitive and instructional aids, and we'll be joined by the Trek, and Trek is the Translating Research in Emergency Care for Kids, I think I might have missed a K somehow. now and there, I'm not sure, but the Trek co-director, Dr. Mona Jabor from the hospital, the Children's Hospital of Eastern Ontario, CHEO, in Ottawa, who has led this national multidisciplinary team consisting of emergency physicians, intensivists, pharmacists, nurses, and specialists in the various topic fields that are part of the PEDS pack. So some great stuff coming up in the next couple of weeks. Thanks again to Erica, Isabel, and Christine for such a great presentation, and thanks again to the audience for joining us today, and we hope to see everyone back here next week. Bye, everyone.